Namaste. I am Dr. P.K. Shantakumari, Chief Physician, Mada Ayurveda Eye Hospitals, Thiruvananthapuram, Kerala. Today I am going to discuss about a very common eye disease, myopia. This term is very familiar to everybody nowadays because the incidence is increasing globally. The reason behind this is very clear, known to everybody. The increased usage of near works, especially on mobile screen and other screen works, and the changes in the food style and the food pattern and the sleep pattern, and also the changes in the works, especially there is no chances for outdoor games. It is decreasing, and always sitting inside a small cabin or in a near work situation. All these are having its own impact in the development of myopia. But the funny thing is that these are unavoidable in the present scenario. So what is to be done? The only thing is to make the eye or the visual organ more healthy and more strong enough to shoulder all these burdens. That is one side. So actually what is myopia? The main symptom is the patient is not able to see far or distant objects, and near objects are clearly visible. Now coming to the physiology of the vision, the first step is the reflection of the light rays from the objects. It is passing in the air in a parallel way, and when it reaches the eyeball, it starts to converge, because all the outer surface of the eyeball, that is cornea, that itself is a refractive medium. Then comes the next medium, aqueous humor, then lens, and then fourth one, vitreous humor. All these are having a refractive index, and it is refracting the light rays while passing through that. It is refracted in such a way that finally it converges on a particular point in the eyeball, on the innermost layer of the eyeball, that is retina. When it focuses on the retina, then starts the visual process, processing the visual development. So first of all happens some reactions like photochemical reactions, and then electrical changes, and then nerve reactions, and finally a nerve impulse is formed. This impulse is carried to the brain through optic nerve, and in the brain the final processing is carried on, and final perfect visual sense is developed. From this description itself, it is clear that if the light rays are not focusing on the retina, vision is not possible. So if there is any defect in any refractive media, this may result. The curvature of the cornea and the refractive index of the fluid system, or the focal length of the lens, etc. are considerable. And the one more point most important is the anteroposterior diameter of the eyeball. If the length is more, possibility of getting on the back side is less. Very simple logic. So this is important because in the growth of a child, this distance also increases, especially according to the height, increase in the height of the child. So when there is an increase in height, there will be increase in the anteroposterior diameter of the eyeball also. And this increase may go up to the age of 19 or 20 years. It is physiological factor only. That is why the chance of getting the myopia increased or progressive is very common in children, up to the, especially up to the age of 20 years. Then what happens? They need more and more support to compensate that. So here there are so many methods nowadays used for the technologies like spectacles, then contact lens, laser treatment, and intraocular, implanting intraocular lens, etc., etc. Here I am going to discuss about the Ayurvedic methods to solve this problem. What Ayurveda can do. Now, physiologically, we can define this myopia as a defect of Kapha and Vata, because the structural stability of any organ is the function of kapha. If the vitreous humor and the lens and this cornea and everything, all the media should be in its normal functioning level, the kapha should be in the normal level. If there is any defect to the properties of kapha, then it will reflect in the refractive power of the eye also. There are different fractions of kapha, and among these there are 5 types of kapha. Among these, tarpaka kapha is more concerned with the eyeball, or especially this refractive medium. And this tarpaka kapha has different properties like snigdha, guru, sthira, pichana, like that. So if these properties of tarpaka kapha is aggravated or defective in any way, there will be some changes in the refraction of this light rays inside the eyeball. Here one more point is to be considered, that is vada, the travel or conduction of light rays from the object to the retina, on even beyond that up to brain we can say, is the function of vada. Among the different types of vada, pranavayu is more important in the function of vision. So if there is any change in the properties of this vada, that also will affect the refraction or the passage of light rays through the eyeball. So if there is any defect or vitiation in the properties of this tarpaka kapha and pranavayu, the possibility of developing an refractive error, also myopia, is very high. Now we come to the treatment side. In short, the treatment is nothing but to bring back the properties of this vada and kapha to the normal state, so that the refraction will be normal and the light rays will focus on the retina. There are 3 equally important steps in the treatment. One is oral medicines, because to make the structures normal, oral things and medication, all medications has very high level impact. So here there are some medicines or some drugs which have some very high level action in the ophthalmic tissues. These are known as chakshushya dravyas. So we have to select that type of drugs for the treatment of any eye disease. So here we have to select the chakshushya dravyas which are more active or having more functional capacity in the realm of tarpaka kapha and vada. And second is some treatment procedures. These treatment procedures, otherwise known as therapies, is very important in the Ayurvedic treatment, because the mode of application has its impacts on each structure, because the surface of the eyeball or the sensitivity of the eyeball or the structures, like this is highly different from that of skin or blood, like that. So we have to use some very characteristic level these treatment procedures, and this is for what I will say, to get more absorption or more impact on these tissue level structures. For example, if you are applying a drop on the eye, the impact will be different from that of applying the medicine in a stream. Like that, the mode of application is very, very important. In the case of the treatment of this myopia, we have to select some procedures seriously. That is, tarpanam and segam are important things. Other procedures can be used according to the then important situation, that is, even the climate changes or the age of the patient or the body constitution of that patient. In Ayurveda, I will say that prakriti, deha prakriti of the patient, and the clinical condition, the severity, if there is any other systemic disease, all these are to be considered. So according to these changes or these factors, we have to select the appropriate treatment procedures. Then comes another factor, that is eyeball movements. We can simply say netra vyayamam or eye exercise, because the movement of the eyeball is very, very important. because we have already seen that light rays are traveling parallel in the air and coming to the eyeball. So the position of the eyeball is very important. Then the constituents of the fluid medium, and that should be kept normal or in a uniform level if the movements are perfect or in a scientific way. So to make any change in the curvature of the eye, this cornea or this focal length of the this lens, or the change in the curvature of the lens, these are possible by correct eyeball movements. That is happening physiologically while viewing the distant and near objects. It is not possible in a diseased condition. So we have to regain that capacity by making the elasticity and this flexibility of the structures to the normal stage. For all these things, practicing the normal eyeball movement scientifically is very important. It should be arranged or formulated according to the necessity of that particular patient. Doing the same exercise for everybody is not at all a good thing. So these three things should be considered equally, that is selection of the drug and then mode of application, and also this third one, eyeball movements. If you are selecting all these things in a scientific way, in a correct way, then we can treat myopia in a successful way. Thank you.